Andrea Kuhlen with the Behavioral Health Services, the Director of Behavioral Health Services. Good morning, ma'am.
Good morning, George.
How are you?
I'm fine, thank you.
Now, we're going through a COVID-19 pandemic. Yeah, it's got to be stressful for you guys.
Yes, it is. It's, and I really appreciate this opportunity this morning to be able to inform the community on how we've been able to adapt our services to meet the needs of the community during this public health emergency.
Well, I would think that your services are increased with something like this goes on.
They certainly are starting to increase, and we've had to adapt our services to meet that need and to meet our ongoing needs of our current caseload.
So how are you guys operating now?
So, right now we're considered, we provide mental health and substance use disorder services, which are considered essential services. And as such, they are determined absolutely necessary even during this pandemic. So, even though we're considered an essential service, right now we're working to incorporate the advice of our public health officials to reduce the spread of COVID-19. So things changed dramatically for us when we heard the news on March 19th of Governor Newsom's stay-at-home order. And we immediately realized that where and how we delivered services was going to change dramatically overnight. So reducing the risk of the COVID exposure is important, and a major component of that effort was going to be how we mitigated as much physical contact as possible. So our immediate response was to really minimize the number of staff we had reporting for work at our clinics, reduce the number of clinics from which we were delivering our services, ensure that we were providing sanitizing products and personal protective equipment for essential staff who continue to report to their work sites, and to provide staff the technology so that they could continue providing needed services to their caseloads from their homes. So right now, we have continued to keep some of our clinics open. For our adult population and our substance use disorder population, we have our clinic in Brawley, 205 Main Street, Calexico, 1501 West Imperial, and in El Centro at 2695 South 4th Street open. And for children and adults, we have our clinic at 101 Hacienda in Calexico open, and our clinic at 120 North 8th Street in El Centro open. For our youth and young adult population, we have a clinic in Brawley at 1535 Main Street, in Calexico at 101 Hacienda Drive, and in El Centro at 1295 State Street open. And of course, our triage unit is open 24/7. But I must explain that even though these clinics are open, we are currently limiting that face-to-face service for our most urgent high-risk clients. So face-to-face services are limited primarily to being delivered to patients who require clinic-based medication support services. And for example, our high-risk clients that receive injections that need to be delivered at the clinic.
So would it be a good idea if they called ahead instead of just walking in?
Well, basically that's what they are doing. They have been instructed to do, and so most of this is by appointment only. And then, all of our routine and non-urgent appointments have been converted from face-to-face to phone and teleconference sessions.
And all the numbers are available on your website, right?
All of the numbers are available on our website, and we have our access line, our 442-265-1525, or the public can call our toll-free number at 1-800-817-5292, and there will be somebody to answer the phone and get them the assistance they need.
And would you guys handle like the stress-related issues? This has got to be stressful for a lot of people.
Actually, one of the things that we've been asked to do by our emergency office operations center is to provide counseling to the first responders that may be experiencing stress at this time and need someone to counsel. So we have a counselor that's readily available for them. But that's anyone, this has been a very stressful time for many people. And, a fear and the anxiety about this disease can be overwhelming. And this can be, the stress of this outbreak can include, worrying about your own health, your loved ones, worsening of mental health conditions, increased use in tobacco and other drugs. And so, if any of our listeners today know of someone or someone they care about or themselves are feeling overwhelmed with emotions like sadness, depression, anxiety, maybe they feel like they want to harm themselves or harm others, they can call those phone numbers and they can get the assistance they need.
Because I would think anybody, it's going to harm everybody, but I would think anybody on the edge of mental illness, this could take them right over that edge.
That's right, and that's why, we have put out flyers and, we've made our services available because we know how stressful this is, and, they may have been functioning pretty, good before this, but this is an extremely stressful time.
And I think the longer it drags on, the worse it gets.
Yes. We're seeing an increased number of calls to those lines and also an increased request for services.
And people have to understand that in protection of themselves and for your people, there are precautions that have to be taken.
Yes. We are ensuring that all of our staff have the proper, protective equipment. And we're also taking measures to ensure that anyone accessing our services is not displaying, a COVID-19 symptom.
Okay, and I'm going to try to get you to, I don't know if you even know this, but do you have any idea on when this is going to end?
I wish I had that crystal ball.
I know it's a question everybody's been asked or asking, and nobody has the answer because, again, it all depends on how everything works out. And
let's hope soon, because I think that, people being out of jobs, kids being out of school, it's just creating, a lot of stress for people. And as soon as this is over, It
is, and that combined with the rumor mill is just horrendous on how misinformation is being passed around.
Right. I think that's why it's important for people to access, reputable sites like CDC and get their information. Maybe limit some of their social media sources and the ongoing news coverage of this, and
exactly.
Make sure they're getting the right facts.
Ed, you don't know how many times I've lectured people on that. Yes, I do work in the news, and we do that, but the news is basically negative. Go to the source. Go to the CDC website. Go to the county. Has some information lines. PMH and El Centro Regional and the city of El Centro have some information lines. Go to those sources and find out exactly what's going on, and you find out that it's not the end of the world.
Right. And I think it's really important that that everyone makes their own health a priority during this time. And there's some very, very important self-care activities that we can do. And those are, get adequate sleep, go out and exercise, walk, ride your bike, and make sure you're maintaining a healthy diet.
Exactly, and just because you're at home doesn't mean you have to stay in the living room, or you can go outside and do stuff.
That's right.
And you should.
You just don't want to congregate.
Well, exactly. You don't want to vegetate on the couch.
That's true.
You can. I mean, it's completely legal. Go out and walk around the block a couple of times.
Right.
Throw your mask on and enjoy yourself.
Right.
My grandson finally found out that he could walk the dog. He's getting a lot of exercise. He's a big dog. Andrea, I thank you for calling, and this is a very important information that you passed along, and people should remember that your website, you're on the county website, they can go to behavioral health and click onto that and get all the information that they need, or find out where they can get that information.
And just know that if, our doctors, our nurses, our therapists, our case managers are continuing to provide services by phone or by, Zoom video sessions. And so there shouldn't be any gap in services for all of our population.
That's exactly a very good point. The services are still there. They're just done in a different way right now.
That's right. And we have staff that will help the clients, access those platforms that they need to if they want to. So there should be no difficulty there.
Okay. You guys, one of the most prosperous departments the county has. I don't know if anybody has seen the way you guys operate, and your cooperation with the other departments is absolutely astounding. You are to be congratulated.
Thank you so much.
You guys do a fantastic job, and going through this, there's no reason to believe that you just won't continue doing a fantastic job.
Even better.
Right, exactly. Exactly, because the need right now is absolutely desperate in some cases.
Yes.
All right, ma'am. Thank you very much. Enjoy your day. Cross our fingers that this will end pretty soon, and but people can rest assured that you guys are there.
Yes.
Thank you, ma'am.
Have a nice day.
Andrea Kuhlen, the Director of Behavioral Health Services for the Imperial Valley.